France is not alone in making preparations for a second wave of the infection. Let's take a look now across other parts of the continent to see how hospitals and intensive care units are preparing. We are joined now from Italy and the Netherlands, two professors, Professor Maurizio Cicconi in Milan and also Professor Joseph Cesiolu speaking to us from the Netherlands. Thank you very much, both of you from the European Society of Intensive Care Medicine. Let's start with you. I think we might just have a small problem in the Netherlands. Let's start in Milan then, if we can. Professor Maurizio Cicconi, can you just tell us what's the situation like in Italy in your intensive care units right now, and how are you preparing for a potential second wave?
Well, the situation is much better now. If you remember, everything started with a secondary outbreak in Lombardy. That's where I work here in Milan at the Humanitas Research Hospital. For instance, we sent our last patient, a survivor, from the intensive care to a normal ward a few days ago. So we don't even have intensive care patients, COVID-19 intensive care patients at the moment. But we are ready in case some of these patients will come. So what happened since the beginning, even if at the beginning we were caught by surprise by this, we worked on two key principles. The key principles are contain the infection in the community and in the hospitals. Indeed, we cannot afford to have the spread of the infection in the hospitals, and be ready to increase your surge capacity for ICU, but also for other acute beds in case there is a second wave. And so we have increased significantly the power of our labs to screen. So every patient that comes to the hospital is screened. We have completely different pathways. So everything is screened so that in case we identify a positive patient, there is a completely different pathway in the hospital. And we can basically try to contain in case there is an infection there. In terms of intensive care, the situation is much better now, but we have plans in case of a second wave. The government has put in place maneuvers to increase the number of ICU beds in the region. We already have, with our networks of hospitals, contingency plans in case there is a spike. And I guess that's what we have to do. That's what we have to do across all of Europe, monitor the spread of the disease and be ready to put maneuvers to contain the infection or to increase capacity if it is needed.
So what about in the Netherlands? What are you doing? We've just heard about sort of, across Europe, different authorities looking at how to brace and prepare for a second wave. Is that what's happening where you are as well?
Well, we have a huge experience behind us, and we have learned a lot. When we had started, we had to get ready in a couple of days. Now we have more time. We know what we should be expecting, although we hope that it will not be as severe as before. We have a plan, governmental and local in hospitals. We have extra beds. We know where to go with the second surge. We have the equipment, we have the medical supply, but most important, you can have all these things, beds, equipment, everything. The most important thing is the health professionals to take care of the patients. We had recruited a lot of other physicians from other medical specialties and nurses from other disciplines. We know them by name, we train them, we will train them in the coming days. And when necessary, when the next surge comes, we will start immediately recruiting them and admitting patients.
Do you think, Professor Cesiolu, that with the lifting of lockdowns, this second surge is almost inevitable? Are you preparing as though it is?
We are preparing as if it is, but as you would know, and everybody would know, this is a new virus. We don't know the attitude of the virus. The reality is that we have not got rid of it yet. When we talk about a second attack, it is already going on in many parts of the world, even in the Netherlands, in a very different scale, of course, not as bad as it was. But we, as I mentioned, we don't know how the virus will profile itself. The only thing what we know is that we have to be prepared. The first time when we were confronted with it, we were not adequately prepared, and we cannot be caught unprepared for a second time. And we need to have measures inside the hospitals, of course, to take care of the patients. But as my colleague said, the real measures are outside the hospital.
Well, of course, a lot of attention and eyes were on Italy and how Italy was handling the pandemic early on, because that was sort of initially the epicenter in Europe of the outbreak. Now that we're down the side, at least, of the first wave of the infection, Professor Cecconi, do you think there should be greater cooperation between different European countries in how to handle it, learning, awfully though, from Italy's experience?
I think we must cooperate better. I think with the European Society of Intensive Care Medicine, we've realized that there was a need immediately to cooperate. What we were able to do, for instance, was to share information as much as possible with video conference that we did almost immediately from the first outbreak in Italy, across Europe and also around the world. But if there is an important thing that we have to realize, is that indeed there is a need for better cooperation. People talked a lot about medical equipment and medicines. I think that's very important, and probably we need to have a centralized way to coordinate this at European, national and local levels. If there is one big learning from this pandemic, is that it does not occur at the same time everywhere, and even clusters can be very different in the same country. If you see Lombardy is very different from the rest of Italy, for instance. And I like to talk about the concept of a kind of an army, an healthcare army, in the sense that we don't have just to probably to move devices and drugs, but maybe we need to be better prepared also to move competencies where they are most needed. An intensive care bed is not just a ventilator and a monitor. An intensive care bed is a group of competent people that can work together. We've all had a lot of help from doctors from other specialties in our hospitals, and it's been great to work together like this. We now have some months, if there is a second wave, to prepare to retain the skills of these people. But at the same time, maybe we need to be better prepared also to have cooperation at regional levels, maybe doctors and nurses that can come from regions that are not affected, and then this could move the other way around. We could also think about that at European level, but I suspect we should first of all identify some principles about how to better cooperate, move competencies. Then we can even think about moving competence between European countries. But I would say, first of all, we need to think
about... Well, we've been
about
looking at how European countries can coordinate with each other. Thank you very much to both of you from the European Society of Intensive Care, Professor Maurizio Cecconi in Milan there, and also in the Netherlands, Professor Joseph Cesiolu. Really appreciate your insight.